panelists assisting in this workshop as well. The Connecticut Affordable Housing Conference, or CAHC, features local, state, and national experts leading conversations that explore challenges, best practices, and brings us together around critical next steps to address key affordable housing issues. Our theme this year is Building Stability, highlighting unique practices to strengthening housing stability for households and communities across Connecticut. You can follow the conversation via Twitter at #CAHC 2022, and you can also follow us at PSC Housing. The session is entitled Housing Connecticut's Older Adults, Lifespan Planning for Affordability and Accessibility. A few housekeeping items before we get started. The session is being recorded, and we'll make sure all the recordings are available as soon as possible. All the participants have entered muted. Please remain unmuted unless the speaker has asked you to unmute. If you have any technology issues, please select the chat icon in the Zoom call-in panel and send it to either myself or Kaylee, and we'll do our best to assist you. And your speakers in a moment will let you know how they would like content questions to be submitted. And we also ask that you, after the session, to complete a session feedback survey by clicking on the megaphone icon in the lobby. Before I turn it over to our presenters, we would like to thank our leading sponsors, the Connecticut Department of Housing, the Connecticut Housing Finance Authority, LaWuza Building Group, the Melville Charitable Trust, and Wells Fargo. Their deep support has allowed the conference to happen again this year. Thank you to our collaborating sponsors. And we have a handful of supporting sponsors that have helped make this conference happen. Thank you. And we want to say a big thank you to the Hartford Healthcare Hartford Hospital for sponsoring this session. And lastly, a quick announcement that the partnership housing data profiles are updated. You can now access the latest housing data for all of Connecticut municipalities in an online interactive format. And each housing data profile contains a summary of important housing data in a town, and you can get the facts on affordable housing or do a deeper dive into the distribution of your city's housing costs. And now I'm going to pass it off to Anna to get us started. Thank you.
All right, great. Thank you so much. Let me just share my screen here. All right, can I just get a quick thumbs up from somebody if you can see me and hear me? All right, so we're good to go. So thank you very much. My name is Anna Dorgazi. I'm one of the Policy and Outreach Directors at AARP Connecticut. I'm joined today by Christy Stewart, Chief Innovative Officer of the Housing Collaborative, and Alyssa Norwood, the Director of the Connecticut Age Well Collaborative. So our goal for this session is to explore some of the implications of this graph right here. So the United States is on the verge of a massive demographic shift. In about 12 years, people over the age of 65 are going to outnumber children under the age of 18 for the first time ever in US history. This has huge implications for our everyday lives. An unprecedented older adult population is going to impact everything from healthcare to what we eat, to product design, to transportation. And as we're going to focus on today, it's also going to impact the kinds of housing that we're going to need to support healthy aging and accommodate a growing population of older and disabled adults who are going to want to receive support in community settings. So Christy and Alyssa are going to dig in a little more on the affordable and accessible housing needs, but I'd like to set the stage a little bit by sharing some background information about how Connecticut has already started to transform the way that we deliver long-term services and supports. So I'm going to try to not be too jargony as I talk us through this, but there are a couple key terms that are going to be helpful to understand as I work my way through these slides. So first, when I say the phrase long-term services and supports, or LTSS, this refers to a variety of medical and personal care services for folks who need assistance with activities of daily living due to age, chronic illness, or disability. So activities of daily living are things like bathing, dressing, feeding, toileting. Home and community, oh, well, let me back up a little bit. These LTSS include paid and unpaid services. They're used by people of all ages. So this isn't just older adults, this is folks across the lifespan with disabilities. And it includes both home and community-based services and institutional care. So home and community-based services, or HCBS, are services that allow people with significant physical or cognitive or developmental disabilities to live in their homes or in a home-like setting. Institutional settings, on the other hand, are nursing homes, intermediate care facilities, and similar locations. And finally, I'm going to use the phrase rebalancing, which refers to policy efforts to shift Medicaid funding and service delivery away from institutional settings and into home and community settings. Connecticut and other states really started to work on rebalancing efforts, again, shifting folks out of institutions and into home and community-based settings, following the 1999 Supreme Court decision Olmstead v. LC, which found that unnecessary institutional segregation of people with disabilities constitutes discrimination, and that this discrimination can't be justified by a lack of funding. So rebalancing efforts in Connecticut and nationwide really began in earnest in the aftermath of the Olmstead decision, which is great because people want to live at home as they age. People with disabilities of all ages want to live at home, homes where we have our memories and our connections to community and where we experience independence. So on that idea of people want to live at home as they age, AARP conducted a statewide survey of Connecticut residents age 45 plus. This was back in 2020, so after the pandemic had started. And we asked folks, where do you want to receive long-term services and supports if you ever need them in the future? 81% of respondents said that they would want to receive care at home with caregiver assistance. An additional 10% said they'd want to receive care in an assisted living facility or group home. These are also considered community settings. We had some other responses, which is why this doesn't add up to 100%, but only 1% of folks who responded to our survey said that they wanted to receive care in a nursing home. Nursing homes are an important part of our continuum of care. And some of them provide great care to older adults and people with disabilities, but by and large, this is not where people see their future selves. Most people want to avoid nursing homes as a care setting as they age. In addition to helping people receive care in their preferred, less restrictive setting, rebalancing has been an important policy shift because it's significantly less expensive than serving people in institutions. Expenditures on long-term services and supports represent a really significant portion of Connecticut's Medicaid budget, which in turn represents a large portion of the state's overall budget. Around 6% of Connecticut Medicaid members receive long-term services and supports, but LTSS constitutes about 40% of state Medicaid expenditures. 32,800 Medicaid members in Connecticut receive $1.7 billion in care each year at a cost of approximately $51,000 per member. So this is expensive, but it's significantly less expensive than serving folks in institutions where it costs about $91,000 on average to provide care to one individual. So given all these factors, the Olmstead decision, personal preferences related to service settings, the financial incentives to serve people in the community, and the huge expected growth in our state's older adult population, Connecticut is serving more people than ever in home and community-based settings. Here's what the trajectory looks like. 15 years ago, Connecticut served about half of long-term services and supports recipients in institutions and about half in home and community-based settings. Through programs like the Connecticut Home Care Program for Elders and the Personal Care Attendant Waiver, 2/3 of Connecticut long-term services and supports recipients now receive care at home or in the community. About 5 years ago, Connecticut hit another important milestone in its rebalancing efforts and began spending more money on home and community-based services than institutions. Right now, that balance is around 60% expenditure in home care and about 40% on institutions. So here is the challenge that we face. We're just starting to see the baby boom generation reach a point where they're going to have an increased need for long-term services and supports. Connecticut's overall demand for long-term services and supports is going to increase significantly over the next 2 decades. And that growth is going to be concentrated in the home and community space. In fact, as the overall need for long-term services and supports increases over the next 20 years, demand for nursing home care is going to decrease by approximately 40%. This means that we're going to see demand for home and community-based services increase by about 34% between now and 2040. On the one hand, this is great news. It means we've taken on the challenge of serving people where they want to be served. But on the other hand, we're not ready. We're just not ready for this change. In a lot of ways, there are workforce issues, there are transportation issues, but what we're focusing on today is that we don't have enough affordable and accessible housing to meet the demands of an aging and increasingly disabled population. So affordability and accessibility are 2 of the key challenges that if we do not address in the next 15 to 20 years, we're going to undermine the last 20 years worth of effort and policy change related to rebalancing and providing care in home and community-based settings, which again, is a lot less expensive, and it's where people want to be as they age. So, in real concrete terms, what do these barriers look like, and what is this lack of affordable, accessible housing meaning for people who receive long-term care? One of the state's successful rebalancing programs, again, just to go back to that definition, program moving folks out of institutions and back into the community, is called Money Follows the Person. So this is a really good case study for our topic today. MFP, or Money Follows the Person, is a Medicaid demonstration project that helps long-term care recipients move back into the community after they've been living in a nursing home for at least 3 months. Since 2008, it's helped almost 7,500 Connecticut Medicaid members move out of nursing homes and back into these less restrictive community settings. These 7,500 include older adults as well as individuals who have mental health and physical disabilities. Only about 1 in 10 Money Follows the Person participants owns their own home. So a majority of folks who are participating in this program, nearly 75%, are renters. And this is where we start to see the impacts of housing on successful rebalancing efforts. 72% of older adults who are trying to leave Connecticut's institutions through the Money Follows the Person program face housing challenges. And that number is actually even higher for folks with mental health and physical disabilities, 86 and 87% respectively there. So as we drill down into this data a little more, we see that the #1 by far top challenge for folks who are trying to transition out of nursing homes is a lack of affordable and accessible housing in the community, coming in at almost 70%. And this lack of affordable, accessible housing has real consequences. An MFP, a Money Follows the Person participant who encountered a housing challenge during their transition process ends up having to stay in a nursing home for an average of 86 to 132 days longer than somebody who did not face a housing challenge during that transition process. And that's just for the folks who do successfully transition. If an older adult does face a housing challenge while they're trying to utilize this program, they're twice as likely to close their Money Follows the Person case without ever transitioning into the community. That means that they're going to remain in a nursing home, even though they want to leave, even though their care needs could be met in the community in a less restrictive setting, and even though it costs Medicaid almost twice as much to meet their needs in a nursing home as it does in the community. So what's the takeaway here? The takeaway is that our lack of affordable, accessible housing is already starting to undermine the state's work to provide long-term care, long-term services, and supports in the community. It's a problem now, and it's going to be even more of a problem in the coming years when we see a significant growth in our older adult population and in the number of individuals who need these home and community-based services. Keeping an eye on the clock, and it is time for me to shift over to Christy Stewart to dig into some of these needs in a little more detail.
Thanks, Anna. And I am going to share my screen. Okay, can you all see that? Yeah, okay, good. Yes. So good morning. My name is Christy Stewart. I'm the Chief Initiative Officer at the Center for Housing Opportunity. Just a little bit of sort of context. The Center for Housing Opportunity is an initiative of the Housing Collective. And I'll run through this quickly, but I do think it's sort of important context. The Housing Collective is a backbone organization working to end homelessness and ensure stable and affordable housing is available for everyone. And we do that through two key collective impact initiatives, one focused on homelessness, which is called Opening Doors, and one which I lead focused on affordable housing, which is called the Center for Housing Opportunity. So at the moment, this is what the footprint of the Center for Housing Opportunity looks like. We have a center in Litchfield County. We have a center in Fairfield County, and beginning in January, there will also be a center in Eastern Connecticut. So just a little bit of context. And what we largely focus on is data research, technical assistance, education, outreach, and advocacy around housing affordability. We work in regional initiatives. We do not consider ourselves a statewide organization. The work we do is always regional. And we feel that that's a critical part of filling a critical need in the housing sector as housing markets are regional. So I want to do a deeper dive today on the data and research piece. In 2021, we published a study in partnership with Urban Institute, Data Haven, Corporation for Supportive Housing, and Source Development Hub. This study was funded by the Department of Housing and the Department of Social Services, and I think grew out of what Anna was referring to as this trend toward rebalancing. So it was very much an intentional exploration of how affordable and accessible housing intersects. And we were charged with basically taking a look at the future of our housing needs in the state from an affordability perspective and from an accessibility perspective. So I'm going to walk you quickly through sort of high-level takeaways on this. And when I'm done, I will put a link to the entire study in the chat if you're really ambitious, so I can share it with you that way. But to take a look at our needs, first, the study team looked at population and housing trends. And the key takeaways there, and Anna just referred to this one, is that our population is aging. And that meeting the housing requirements of older people will become increasingly important for Connecticut. It's projected to experience a decrease in people ages 34 and younger, as well as those ages 55 to 74, while the population ages 35 to 54 will grow slightly. The largest increase is projected for people 75 or older. And by 2040, national demographers say that the state's oldest residents, the portion of the state's oldest residents, will grow by over 68,000 folks. The other key sort of demographic change that we're watching is the change in households by race and ethnicity. So while the state is aging, it is also projected to become more diverse, with more households headed by people who are Latino, Black, or Asian, and fewer households headed by white people by 2040. And this has implications for the type of housing that we build, and is just another key indicator when we're looking at population trends that the housing sector keeps an eye on. So again, an aging population, a decline in the white population. and noting that housing production rates have not recovered since the Great Recession. So a couple of terminology things. We talk about affordable housing in our study, as with many academic studies of affordable housing, you'll hear us use the term assisted housing. When we say assisted, we're talking about affordable, and the assisted means it has a government subsidy. When we say accessible, we're talking about units that are built to serve folks with disabilities. So just that distinction between affordable equals assisted in the affordable housing space, and accessible equals sort of accommodating folks with disabilities. So taking a look at the overall gap in our affordable or assisted housing market in the state, we currently have over 86,000 more very low income households than housing units that are affordable to folks in that income band. So the high cost burden rates for very low income households arise from this shortage of affordable housing units that you see here. And although most other income bands appear in our data to have a surplus of affordable housing units, there's also a large gap that you'll see here at the high end, which means that high income households are competing with lower income households for less expensive housing in these low, mid to low, and mid-high ranges, which exacerbates the affordability challenges for low-income homeowners and renters down at the very low end of the spectrum. So no county in Connecticut has enough affordable housing units to meet the needs of its very low-income households, and the largest gaps are in Fairfield, Hartford, and New Haven counties. Taking a look at that gap analysis, the key takeaways of our study are just that now we know the gap. So at least 86,000 units affordable to very low income households, which means at or below 30% of county median income. Their very low income households are projected to decline in number, but the decrease will not close the housing affordability gap. The most prevalent assisted units, so affordable units in Connecticut, are federal housing choice vouchers and Section 8 project-based rental assistance. And the largest numbers of state-funded assisted units come from moderate rental housing programs. And then this is key. Thousands of units are deed restricted as affordable right now, so assisted units with deed restrictions. And those restrictions are expiring. And over the course of the next 20 years, we will continue to lose thousands of affordable units a year. Here's the accessible housing trends. And this really, now we're going to get into that intersection of affordability and accessibility, and really lean into what Anna was speaking about. So if you look at, this is just a projected change in households with someone with a disability. So we're looking at mobility needs, sensory needs, and mobility or sensory needs. And you can see the increase as we move out towards 2040. Again, this has to do with an increase with the fact that our population in general is aging. But this is, I think, an important piece of data. So not surprisingly, there's a relationship between affordability and accessibility needs. Generally, a larger share of low and very low income households report having at least one member with a disability. And roughly a third of assisted, so affordable housing in Connecticut, needs to be designed for residents who have a disability, especially those with physical, ambulatory, and cognitive disabilities. So this is a big deal. This means that going forward, a third, 1 in 3 of every affordable unit that is produced or preserved in the state of Connecticut needs to be accessible. And this is not something that is on a lot of housing policymakers' radar right now. And we are really trying to change that. And we'll get into the recommendations that we make to do that going forward. But these are the key takeaways about our accessibility data. sorry, I just had something very strange pop up on my screen. The aging population will increase the need for accessible housing over the next 20 years. A lack of standard data and tracking protocols really make it hard to assess and quantify the number of accessible units in the state. And currently, most accessible housing in the state is located in urban areas. And we just spoke about the 1/3 of all housing units needing to be accessible. I do want to flag that this lack of standard data around accessible units makes it almost impossible for the state to inventory and quantify the number of accessible units it has, which makes it then doubly impossible to look at setting targets as we build housing to make sure that we have enough units that are both affordable and accessible. So the study team made a number of policy recommendations to the state of Connecticut, and we are seeing some of those filter through, but these are long-term policy goals and recommendations. And the key one for this panel is the integration of affordable and accessible housing strategy at a statewide policymaking level. So while the traditional way that the state works to bring affordable units online is through programs like LIHTC or New Market Housing Tax Credits. And those are typically what we call reactive investment by the state, in that developer comes up with a project and goes to the state to get it funded. What we are recommending that the state start doing is taking a much more proactive investment approach, where they look at the data, they look at the need that we just discussed, the gaps, and they target state investment accordingly. So proactive investment. Regional planning, we feel it is critical that housing markets, which are entire regions in our state, that housing development is planned regionally, because when it's planned across 169 towns across the state of Connecticut, it is not necessarily as impactful as it could be. So we think that regional context is critical. I think that's especially true when we're talking about planning for accessible housing. And then using data to ensure that we're prioritizing every resource available to the state of Connecticut based on need, and not based on where the development opportunities present themselves. I'm going to walk through in a minute sort of the priority actions that we recommend. And I do realize I have like 2 minutes left, so I'll skip through this. Key recommendations, right? We need to tackle this in 3 different ways. We need to preserve the housing that exists, especially as assisted units deed restrictions expire. And in the act of preserving these units, we need to make sure that they are accessible as well. We need to produce more units. No surprise to anyone, you saw the 86,000 unit gap. That's a really big deal. And again, we need to do that. We need to make sure every affordable unit we produce, that 30% of those are accessible. We need to protect the housing needs of our most vulnerable populations. And we need to monitor and document housing, especially affordable and accessible housing, and the intersection of those 2 things. There's a lot of work the state has to do on how it collects and uses data to do that. Even just the fact that there are, for example, 23 public housing authorities across the state who couldn't answer the question when we asked of how many accessible units they have in their portfolios. So those kinds of things are important. So key takeaways from my perspective are the overall shortage of affordable units at 86,000, the need for a dual targeted housing strategy that looks at affordability and accessibility, that 30% of all affordable housing built or preserved going forward should also be accessible. and that we all have to work together, which is what Alyssa, Anna, and I are trying to do now, to make sure that we elevate this sort of issue and these kinds of solutions at a statewide level. So I'm stopping my share so Alyssa can share.
All right, thank you so much, both Anna and Christy, for such incredibly thorough and thoughtful presentations you make for a tough act to follow. My name is Alyssa Norwood, and I am director of the Connecticut Age Well Collaborative, and I'm pleased and proud to have both Anna and Christy serve on my steering committee. And now, good afternoon, everybody. We're on the other side of 12 o'clock. So this isn't a presentation about racism or the history of redlining, but I think it's important to note and start with a reminder that in the aftermath of the Great Depression, the US government set out to evaluate the riskiness of mortgages and left behind a stunning portrait of the racism and discrimination that have since shaped American housing policy. And I'll be brief because this isn't a talk about redlining or gentrification, but I do want to take a minute to talk about these issues, and you'll understand why in a minute. So if we take a moment and we look at these two photographs, it's a case study, but a familiar portrait that's typifies a broader reality in Connecticut and in states across the United States. We can see on the top photograph a street in Hartford, in which the majority of the North End through this process was ranked a grade C, one notch above least desirable in the 1930s by surveyors. And then in the bottom, for folks who are familiar with Hartford, you'll see Scarborough Street in the West End neighborhood of Hartford, an area that received a favorable rating. So this is these images were taken from a 2016 piece by Susan Campbell on redlining and its implications on Connecticut neighborhoods. And one response to the implications of redlining since has been investment, which of course results potentially in gentrification. National Geographic gives a great definition of gentrification, which describes it as a process where wealthy, college-educated individuals begin to move into poor or working class communities, often originally occupied by communities of color. Those moving in, of course, may have goals that are at odds with the people who've lived there for a long time. Rising costs of living and changing community can make it difficult for those who have originally been longtime residents to adjust. And as a result, people of color and other minorities and those who own businesses might be driven out. At the same time, however, gentrification brings much needed investment into not long neglected areas. So in short, it's complicated. So why do I raise these issues in the context of a conversation about housing Connecticut's older adults? And I want to be clear first on what I'm not saying before I articulate what I am saying. So what I'm not saying is that aging, dementia, and disability are related to racism, redlining, or gentrification. That's not my point. But what I am saying is that place matters, and place matters profoundly. And whether it's an incidental byproduct of other forces, implicit ageism or ableism, historical inertia, or some other combination, the fact is we've designed communities that in fact do have an impact on aging, dementia, and disability inclusivity. And by way of one example, just to give you two comparisons, and for those who are students of smart growth, these sort of pictures are probably very familiar to you. On the top is an image of downtown Putnam. On the bottom, it's unimportant where it is. I live in West Hartford and it happens to be Corbin's Corner, but it could be anywhere USA. This dichotomy of what it is to be able to readily navigate a community, to have it be walkable, to be able to live life if you're one of the 1/3 of Connecticut residents that either can't or doesn't drive for a variety of different reasons. And yet we've designed our communities in a way that's not necessarily cognizant of that reality. So we looked at community conditions, just to give you an example of housing stock. 70% of Connecticut's housing stock is single family with the bedrooms on the second floor. And just an interesting fact is that in general, housing in Connecticut has been designed historically based on the height of an average height male who's between the ages of 20 and 40. So as it happens, this is my house. I live in West Hartford, and a number of years ago, I was walking with my then very young daughter in her stroller to go pick up one of my children from school. And in one of those moments that we all have, a water bottle that was in the undercarriage of the stroller, we went over a bump, it fell out, my foot slipped on the cylinder of the water bottle, down I went, and I twisted my ankle. And I successfully hobbled to the elementary school, picked up another child, came home, and it really was this watershed moment. The whole reality of my house changed for me. And I still remember the incredible pain of going up that second flight of stairs and needing to weigh sleeping on the first floor in an unfamiliar space versus the comfort of my own bed. But we often speak about these issues in the form of otherization, people who are living in nursing homes and people who are aging and people who are differently abled. But in these watershed moments of a car accident or a fall or a diagnosis, we all will have a loved one or will directly at some point in our lives, if we don't already, have a moment where we become either suddenly or slowly differently abled in our cognitive or physical abilities. So I just want to emphasize that this is our shared journey, our shared vulnerability, but not necessarily our shared inevitability. And why do I say that? So one, I want to dispel and disrupt the notion that aging inevitably leads to decline. That's not the case. We all know somebody anecdotally, and the data supports that successfully lives independently, vigorously, with great community engagement, irrespective of age. And we'll talk more about how we can disrupt this story at a talk that the Connecticut Age Well Collaborative is giving in February about disrupting the narrative of aging and ableism. But the second response to this is that we can choose to design and plan differently, as Christy, through her data, shows is absolutely critical. Because otherwise, and Anna touched on this, the long-term path is institutional care, which again, Anna mentioned, has an important role in the system. We celebrate it, but the sort of the stereotypical picture of the homogeneity of that setting is in the bottom photograph, which might elicit different emotional responses for all of us who are looking at this. And there are successes in that realm too. So the photograph in the top left is a picture of Masana Care, which has implemented a really innovative partnership with Quinnipiac University, one of the state's and age-friendly universities, that has a program where university students reside in that long-term care institutional setting. And on the right is an intergenerational program in Greenwich. But the point is, again, this idea, again, bearing the data in mind that Anna presented about the importance of honoring what Connecticut residents are articulating they want, and that's to live at home in communities. In the end, it's about honoring choice and access or opportunity to intergenerational encounter rather than living in a space of homogeneity. And relating back to the beginning of the presentation, when we spoke about gentrification before, and that it's a complicated issue. So the tie-in here, this is different than gentrification. We're not talking about gentrification, but because this is a housing audience, I wanted to invoke at least a familiar concept. So rather than this idea of pitting long-term residents against newcomers, many people believe that the ideal is one of coexistence and equilibrium, and that the idea of diversity makes our community stronger. And yet we have this very strong societal bias baked into all of our systems around age and ability-based segregation. And again, that isn't to say that every space should be intergenerational, but this idea of honoring choice and opening to the possibility that, notwithstanding the fact that it might not always be comfortable, that homogeneity in any kind of absolutist form is problematic. So what is the Connecticut Age Well Collaborative? In the end, it's a response to these ideas. It's a group of committed people across a variety of different sectors that all have a vision that municipal government, councils of government, and a variety of other stakeholders can work together to create places where we can all thrive as we grow up and grow older and ultimately create places that are more aging, dementia, and disability inclusive. Again, we talked about redlining and segregation, and one thing that I just want to add and embed here is that there are real and significant impacts as we age and as we become differently abled as a result of underlying policies and communities. But those realities are all compounded for people who have been historically disempowered. So whether a person of color, somebody from the LGBTQ population, so there's this doubly difficult circumstance that we need to work to overcome to make sure that everybody has a place to live and to age and to thrive with quality and with dignity. So our framework rests on a model that was developed internationally by the World Health Organization as part of a international age-friendly cities initiative. Here in Connecticut, we've expanded the scope of that work to include not just aging, but also dementia and disability. Each of those groups are distinct. There are populations where there are overlapping realities, but there's a lot of opportunity for synergy. But if you look at our framework, it's broad. Housing is a huge piece of it. And it all rests in this idea that, again, there's not this notion of otherization, that if we create communities that are more aging, dementia, and disability inclusive across all these domains, we'll arrive in a place where we have just and more equitable communities for everyone. So a little bit about who the collaborative is in terms of the constellation of other key partners and players. So some folks ask us who we're funded by. We're generously funded by both the State Department of Aging and Disability Services, who has a great interest in this topic as a result of the policy forces that Anna talked about and the importance of ensuring that communities can support the state's rebalancing efforts, as well as the Point 32 Health Foundation, which is a key philanthropic partner and funder. Two additional organizations that are important is, much like Christy mentioned, that the Centers for Housing Opportunity or initiative of a backbone organization. Connecticut Community Care is the Connecticut Age Well Collaborative's backbone organization and fiscal sponsor. And we also want to acknowledge the Connecticut Commission on Women, Children, Seniors, Equity, and Opportunity, and its statutory charge to lead a statewide livable communities initiative by memorandum of agreement effective this past September has been delegated to us, and we look forward to working in partnership with them to move that critical work forward. So we're here talking about housing, so that's where I want my focus to be. So what does innovation look like? What are some creative solutions to this really challenging problem that Anna and Christy have laid out for us? And there are some that I'm not going to discuss. One of them is accessory dwelling units, not because they're not an important part of the solution, but I think it's a moment for celebration in Connecticut, where as a result of legislative advocacy and thoughtful discourse over the past several years, we've arrived at a moment where making accessory dwelling units a pathway and an opportunity as a right in communities has gained a lot of traction. So rather than focus where Connecticut's been successful, I want to talk about some innovations that have really been underutilized in the state and that are ripe for growth in terms of creating both more affordable and accessible units. And one of those is co-housing. So for those who aren't familiar with what co-housing is, as it says here, is it's a residential alternative for people wanting opportunities for strong social connections while aging in community. So what does co-housing look like? Typically, it clusters private homes that are put around collectively owned and managed spaces like a communal kitchen, outdoor areas such as communal gardens. So the specific contours of what a co-housing community can look like depends on the specific development. The theory originated in the 1960s in Denmark. There were a number of families who felt existing housing and community options didn't meet their needs. For anyone who's ever walked around their neighborhood and thought to themselves, you know, gee, what a waste that we each have a shed in our backyard with its own lawnmower and its own leaf blower and its own snow blower. And what would it look like if we had this sense of collective responsibility and mutual caring? And there were one shed that had all of those tools that we used communally, that we lifted each other up in moments of challenge and knew that somebody in our co-housing community perhaps couldn't rake or clear snow or whatever needed to be done that day, either in a very short-term way or with a longer-term commitment. The populations within co-housing units are also varied. There are some, importantly, that incorporate affordable housing units. They can be exclusively for older adults. They can be mixed generations. There have been tremendously successful co-housing units for persons with intellectual disabilities. And it's not always easy, even though there's always long-term success in these for the most part, because there is this investment and learning curve necessary in helping a diverse group of people learn to live together. There are hundreds of co-housing communities in Denmark. The US is behind, but slowly catching up. We have 160 in the United States, approximately in 25 states. And over to the right, those of you probably are familiar, Rocky Corner would have been Connecticut's first co-housing development in Bethany, Connecticut. Rocky Corner is currently on hold due to a foreclosure proceeding. Approximately 2/3 of the homes are close to completion. You can read the sad part of that story in an article in the New York Times that was released earlier this year if you Google Rocky Corner in Bethany, but it still represents hope for what's possible in the state in terms of reinventing some of our housing models. A second opportunity, so we often hear the phrase downsizing, not practicable for some individuals. There are some really innovative models around right sizing. But I want to thank our AARP friends nationally for a series called Equity by Design. And there are some incredible models coming out of Ireland around not just retrofitting a very large space that might have bedrooms on the second floor to accommodate the needs of somebody that doesn't need that size space anymore, but also retrofitting it to create a separate rental unit, which might afford that person income, which might allow an individual to provide caregiving services living in the home, but with some separation and dignity and privacy. And the last model that I want to mention, I briefly alluded to the Quinnipiac partnership with Masonacare. Going in the other direction, there's been a boom in intergenerational housing, which are simply housing arrangements that intentionally mix older and younger people, and most prominently give older adults opportunities to secure housing on college campuses and be part of a vibrant, thriving intergenerational environment. So if you're interested in learning more about the work of the collaborative, about housing and across other topics, I just want to note that on November 30th, we're a relatively new organization. We're having our launch event, and you could register for that if you visit ctagewellcollaborative.org. So that's November 30th at 11. And then finally, in partnership with the Connecticut Conference of Municipalities, we're launching our AgeWell Academy, which for anybody who works for municipal government is eligible for CMMO credit. There'll be recognition for folks who attend all 5 of our events in 2023, including an in-person event that we'll be having at the Capitol to honor and celebrate incredible innovations around aging, dementia, and disability inclusivity happening across the state. So I thank you all. I celebrate the collective impact model, and I remind you all that alone we could do so little. Together we can do so much, and celebrate Helen Keller's optimism at this time. So thank you so much again.
Thank you everyone for joining us. I know that the next session has already started, but if you have any questions for our speakers today, please feel free to add them to the post-session survey, and we'll make sure that we get them to Alyssa, Christy, and Anna so that they can respond to you all. Thank you and have a good afternoon, everyone.